is, what cervical cancer itself is. Can you please enlighten us on this?
All right, thank you. Yeah. So cervical cancer, like is rightly said, is the cancer of the cervix. So, and then we know that cancer is abnormal proliferation of cells in any part of the body, like an abnormal growth that is growing faster than it should. And then, so we have the cervix as well. So when we now say cervical cancer, the cervix currently is the opening between the vagina and the uterus. So the opening, the way between the cervix, between the uterus and the vagina is the cervix. So combining the two, it just means that the cancer or abnormal growth at the opening between the vagina and the uterus. And then it starts gradually, starts little by little, and if proper care is not taken, that is when it grows to a full-blown cancer. It starts with small, the LD cells, the normal cervical cells, cervix cells, growing abnormally on the surface of the cervix, and then at a point, it starts with small lesion, and then gradually it gets expanding, and if proper care is not taken, it becomes a full-blown cancerous cells that not even that leaks to every other organ in the system. But the main point is it starts at the cervix. So any cancer, any abnormal growth around the cervix or in the cervix is what we know as a cervical cancer.
Okay, thank you very much for that insightful explanation and telling us what cervical cancer is all about, to have a deeper understanding on what we are talking about, which is a very, very broad explanation. Thank you very much. So, since we know what cervical cancer is, where it happens, which is in the cervix, as you said, what are the symptoms? Some people believe that when they see some symptoms, it's for another thing. So some people can be having headache, like, oh, I need to treat typhoid. Some people can be having headache, like, oh, I need to treat malaria. So I believe it's also very, very important that we know the things that we can, when we see these things, we can be like, okay, these are the symptoms, or these are the things that can lead to this. Or, okay, when I see the symptoms, I need to contact my doctor and get tested, and, okay, likely things that can cause this. Not that, okay, we just believe when we see something and we just believe that, okay, this is what I think I have. So I believe we need to know the symptoms as well, which is a very good question that I got from someone, which she was asking that what are the symptoms of cervical cancer. So we'd like you to explain to us and enlighten us on the symptoms that comes with cervical cancer.
All right, thank you so much for that. Yeah, like you said, the symptoms, a particular symptom can be as a result of different ailments. However, cervical cancer has its own symptoms that once you start seeing, you should go as fast as possible to your physician. And one of those symptoms is blood spots or bleeding between or following periods. For instance, now let me put it like this: an abnormal bleeding, maybe during the menstruation or after menstruation, that is not usual. You just discover that you are bleeding abnormally, maybe spots, or at the point is the flow is getting much. It is something that you should be concerned about. And then another thing is the menstrual bleeding, normal menstrual flow that is more or takes longer than the normal time. For instance, now if your period, if your menstruation cycle or your period takes just 3 days, and then you are seeing it for 5-7 days, it is something that you should be concerned about. Those are part of the symptoms of cervical cancer. And then sometimes it comes very, very heavy, abnormally heavy compared to how it used to come. Then another symptom is bleeding after sexual intercourse. For some people that you know how you do your thing, and then suddenly you just discover that, okay, after sex there is bleeding. which is not actually normal, and which is not as a result of any wound around the genital region. You just discover that there's abnormal bleeding. So those are after sex. So that's one thing. And then abnormal vaginal discharge. Too much of vaginal discharge, you just see things coming out like pores, like foul smell and all, just dripping abnormally. Those are things that you should be concerned about. Again, pain during sexual intercourse, abnormal pain when you are having sex, or when you are in the process of sexual intercourse, and then you feel pains around the pelvic region, and then which are usually abnormal. These are things you should be concerned about. And then the pelvic region, when there is pain around the pelvic region abnormally, consistently, these are things that should be noted and be concerned about. And then some different kinds of back pains that you cannot explain, that you cannot actually pinpoint a reason responsible for the pain that is consistent. So these are things you should look out for, that they come together. They are like signs or symptoms of cervical cancer. However, that you have this does not necessarily conclude that you have cervical cancer. Like I said earlier, a particular symptom can be as a result of so many other ailments. So it is until when you go for proper checkup, when you meet your physician, and then you are properly evaluated, and then you are diagnosed. Those are just symptoms until proven to be cervical cancer. So first thing you do when all these symptoms comes up, you don't have to wait for all of the ones that I counted to come at once. Once you start seeing abnormal bleeding during or after your menstruation, or abnormal pain at your pelvic region, just go and see a physician immediately to rule out the possibility of cervical cancer. Thank you very much.
Okay, that's a very good one. Thank you so much for those points and giving us an idea of the symptoms of cervical cancer. Thank you very much, scientist Oyetun Akindele. So while our guest was speaking, someone important, a dignity and a special woman joined us on the program, and I would like her to as well herself. She's actually a colleague as well, and we did a lot of studying together during school days. So, Ms. Damilola, I would like you to actually introduce yourself for a few minutes or a few seconds. Any one out of the two. Thank you very much. Let me know if you can hear me, Ms. Damilola. I sent an invite. Let me know if you can hear me. All right, I guess we come back to that. I don't really know the issues with the internet. So the next question is what are the risk factors for cervical cancer? Like what are the things that can cause cervical cancer? Things that can lead to it. So another question that I got it, I think is also very, very important. Things that we can avoid as well. Thank you.
All right, thank you so much. So, like I said earlier, that cervical cancer starts with lesion that, if not taken care of, can then grow to precancerous cells and then to cancerous cells. And then the risk factors, in fact, the major causative agent of cervical cancer that is responsible for about 90% of the cervical cancer cases is this virus that we all know as HPV, human papilloma virus. So it's the virus that is actually responsible for 90% of the cervical cancer cases worldwide. And then this virus is a DNA virus, and then it has different serotypes, like about over 150 types of HPV. But the ones that are really, really associated with cervical cancer is HPV type 16 and HPV type 18, which are responsible for about 75% of cervical cancer globally. And this virus is usually transmitted through sexual intercourse. So that's the first risk factor. That's the major causative agent for cervical cancer globally. So, and then we have other types of this HPV, like HPV 6, HPV type 11, that are responsible for other diseases like genital warts, but not cervical cancer. The only strain that is responsible for cervical cancer is type 16 and then type 18. That's number one factor. The second factor is immune system deficiency. So for some people that have low immunity, or they are immunocompromised, so they stand a chance or a risk of contracting this virus, which can therefore lead to cervical cancer. That is a second factor. Another factor, which I will tag as a third factor, is the other strains of HPV that are present in the person or in the system. Like for instance, that HPV type 6, type 11, or even type 41 or type 35, when left in the system untreated for a long time, is like a prolonged infection of this virus. They can in a way be triggered, you know, to lead to cervical cancer. So that is factor 3. Then another factor is smoking. It has been proven scientifically that women that smokes heavily are prone, or they are at risk of developing cervical cancer. Why? Because the smoke leads to a kind of distortion to the epithelial cells of the cervix. So it causes a condition that we know as cervical intraepithelial neoplasia. So once a woman smokes too much, it leads to that, and that in a way can also lead to cervical cancer. Another thing is oral contraceptive. If a woman is taking contraceptive for more than 10 years, maybe as a form of family planning and all, and then you have been on a contraceptive drug for more than 10 years, that type of a woman is prone to cervical cancer. And then another risk factor that we cannot but talk about, especially in places like Nigeria, is the socioeconomic factor. That is when there is lack of facilities or resources to screen people, because it is when you are screened that you know, okay, you have a particular condition. But if there is no facility to do that, it's a problem and is a risk on its own. So those are part of the risk factor. Another thing is age. There are some age group that are prone to it. Like I said earlier, HPV is a virus that is usually transmitted by sexual intercourse. So, and then if we relate that to age, we know that the ages between from 15, they're about 15 to about 44, are usually sexual active. So due to that, they are prone, to contracting the HPV, which can therefore lead to cervical cancer. So those are the major risk factors. And like I said earlier, HPV is the first, or let me say the most sexually transmitted infection globally. It is ranked the most sexually transmitted infection. So it therefore means that if you can avoid HPV, you can avoid cervical cancer. I hope I've been able to answer the question.
Yes, you have been able to answer it more than enough. Like more than enough, and a lot of points have been gotten. And I hope people that are listening are actually jotting down some points, because I am as well, so that we can go back to it after listening, and we can after the event, and we can listen to it and get more points. Because some things when it's being spoken right now, we might not be able to get all the information at once, but we can go back to data and read these things that is being communicated to us, because it's very, very important to know these things. So thank you very much, scientist Oyejo Akindele. We really, really appreciate you and your time and for giving us this knowledge. Thank you so much. So the next question I'll be asking is, how often should a woman be screened for cervical cancer? Because a lot of women believe that once I do this test, I've done the screening and it's negative, then that is the end. I don't need to do it again. So as it is believed, and we have said that it is very, very important, because I believe it is important. And I'd like to ask you, so is it important for women to do this screening more than once? Like, how often should they do it, and is it important to do it more than once? And why do you think it is important to do it more than once? I think that is how the question should be, because the person actually sent me, how often should a woman be screened for cervical cancer? But I would like to chip in this one too. So is it important, and why do you think it's important that women get screened more than once? Thank you very much.
All right, thank you, Miss Odedele, once again. Yeah, it is very, very important to get screened. It is very, very important to get screened and to be screened more than once. And then there is an algorithm for screening. There is a standard timing approved by the World Health Organization on screening. So let me just to make it faster, let me just put it this way. Now, we have different methods of screening. We have the HPV DNA screening. We have pap smear. We have VIA, which is visual inspection with acetic acid or acetone. And then we have colposcopy. So, but most importantly, there is a way to screen that has been approved by the WHO. So, in a country where there is availability for PCR, that's polymerase chain reaction equipment that can easily test for HPV DNA, that is human papilloma virus DNA, it is best that you go for a screening every 5 years for HPV DNA. So if you go for HPV DNA screening and then you test negative, the result comes out negative, then you can come back in the next 5 years. That's one way. Another way is, if you can afford it, or if it is available within your geopolitical zone, HPV DNA in conjunction with pap smear test can be done as well. So if that comes out negative, you can repeat it in the next 5 years. Then, but if you are doing only pap smear, that is pap test, if you are doing just that, it should be done every 3 years. Every 3 years. So that is how frequent the test should be done. That is to rule out, because anything can happen between the space of your testing period and the next time you are testing. For instance, if you do HPV screening today and then the result comes out negative, that result is only valid for a period of 5 years. Within the period of that 5 years, anything could have happened. You could have contracted it and all. So by rescreening, you'll be able to know, you are still actively free from HPV. And then if by the second screening you discover that you are positive, that's not the end of the world. You go for treatment. So that is why it is important to screen. Like I put it the other way, if you are doing just HPV DNA every 5 years, if you are doing HPV DNA plus pap smear every 5 years as well, if you are doing just pap smear, that is every 3 years. So that is how the screening is, and that is how it should go. Thank you. I hope I've been able to answer that question as well.
Yeah, that was a very, very insightful, and thank you once again. I believe you answered all the questions. You told us why it is important and how often the woman should get screened, which is very, very important, and why we should. So I believe by explaining this, a lot of people will be able to understand the importance. It's not about I won't have it, I don't have it. Nobody's going to have it in Jesus' name or in her last name. so nobody's going to have it. But it's just the normal precaution and normal screening, so nobody's going to have this. But I believe that it's something that we should all do it, because some people are actually have it in their genetics. But if they don't do it and they believe that okay, I won't have it, there is no way they are going to get screened and detect it, because early detection is also very, very important, which is of very much advantage, and which is why this awareness is even created in the first place. So screening doesn't mean anything, doesn't affect anything. It's just to get screened and be screened. So thank you very much for answering the question. Enough for us to understand. Thank you very much. So the next question I'll be asking is that how can a woman get screened? So I get a lot of questions, requests and DMs of people telling that, oh, Miss Florence, I have a lot of tests I need to undergo, but I don't know where to go to. I don't know how to go about it, because we as a medical lab scientist, we believe that okay, there's a lab everywhere. People are meant to come to the lab to get tested, but some people don't. They are not even aware that there's a lab somewhere, or they're not even aware of where to go to when they need to get tested, or how they need to go about it. So the next question is that how can a woman get cervical cancer screening? How do they go about it when they want to get screened? Like a woman that has decided that okay, I want to get the screening. What is the next step for them to do? Thank you. And while we were on discussion, while our guest was explaining some things to us, was answering our questions, another important guest joined the program, which I'll be requesting for her to also introduce herself. We are still waiting for Ms. Damilola. There is a complication with the network and the mic, so she couldn't introduce herself to us yet, which she's also still on the program. So I'll be inviting her to speak with us and introduce herself, because she's also a colleague, a well-learned colleague, which has been a very good friend for a long time. The name of Mrs. Omolola Abegode. So Miss Omolola Abegode, sorry, not to Mrs., but soon to be Mrs. in Jesus' name. So I hope I haven't gotten cross from our question. So the next question is that how can a woman get this screening, this cervical cancer screening? Thank you.
All right, thank you once again, Miss Odedele Florence. Yeah, it's a pleasure to be here once again. And then let me go straight to it. Yeah, how to get screened is very, very easy. It's very, very easy. Now, like I said earlier, we have like 3 basic screenings that are generally acceptable and then that are accessible in this part of the world. We have the HPV DNA, we have the pap smear, Papa Nicolau test, which we often call pap smear. Yeah, we have that. Then we have VIA as well. That's visual inspection with acetic acid. So they are tests that are common and then they are accessible. So, but however, in screening, there are priorities. Take for instance now, like I said, HPV, what we are screening for especially, first off, is HPV. You understand? So, and then we said that this cervical cancer is closely related to HPV infection, which therefore means that we should tackle how HPV comes in, and then we'll be able to tackle cervical cancer. So, and then who are the people that are really, really prone to HPV? There are people that are sexually active. So that is why there is screening priority to some age groups. The screening priority for this age group is dependent on the sexual activity of that age group, and that is about, in Nigeria, we can pick from about 25 to 45. So they are supposed to screen, like I said earlier, for pap smear every 3 years. If you are doing HPV every 5 years, to be proven negative. So that particular age group are supposed to be screened. They are prioritized. However, that does not mean that other age groups cannot. But at least the age range that is very, very prone to having this condition is the age that I mentioned earlier. That's between 25 and then 45. And then this HPV, like I said, is very common, very, very common, very, very common. And then some people can even fight it off without any medication within 2 years of infection. For instance, If a person that has good immunity contract this virus, this HPV virus, within 2 years, the immune system is supposed to suppress it and destroy it without even medication. But if the immune system is not able to, that is where screening can help out. And that is why this age group, usually within from the age of 5 and thereabout, if the virus is contracted before the age of 22, it should have been destroyed by the immune system. But if by the age of 25 you still have it, the screening can therefore make us know, and then you go for treatment. So how to go for the treatment for the screening is easy. Just locate a reliable laboratory that has quality management system, and then enter, and then you can meet any of their facilitators and tell them, okay, you want to screen for cervical cancer. Definitely they should know that, okay, you have the option of HPV, you have the option of pap smear, you have the option of VIA, and then it is done painlessly. The sample is collected via the proper procedure. The cervical smear is taken, and then it is sent to the lab for proper staining. And if it is HPV, the cervical scraping is done as well with the cervix brush, and then it is sent to the laboratory as well for a PCR analysis. And then the same thing with the VIA. The cervix is opened up, and then an acetic acid is added to the cervix, to the surface of the cervix, to see if there's going to be a color change that would indicate abnormal cells present in the cervix. So when the acetic acid is added to is rubbed on the surface of the cervix, and then there's discoloration, it means that the cervical cells, they are tending towards, it could be a precancerous cell, it could be a lesion, but it is worthy of proper checkup. That is what the VIA does. And from there you can go for pap smear, you can go for biopsy to actually properly diagnose that, okay, this is a cancerous cell or a precancerous cell, and then treatment can follow. So those are the ways that the screening can get done. And then if you are looking for a place to get that done in Ibadan, access to Basic Medical Care Foundation is always available, very close to State Hospital Ring Road. And all these facilities are available for all this screening. And I'm sure we have that in Abuja and every other place too. So that is the way that screening can be done. Thank you. I hope I've been able to answer that question as well, Miss Odedele Florence.
Yes, thank you very much for the information that is being passed. And this is why the event is actually tagged cervical screening awareness. Like you said, like I want to make something very, very clear. Like you said, if this screening is done and maybe the result says, like in a layman language, when the result comes out, so you can't tell them to come and be checking the reaction. So when the result comes out, they either know if they are positive or negative. So when a woman is positive, like you said, the immune system can actually press this down from the system, or they can be on medication. We can press this down, which means even if a woman is positive, it can be treated, and it can go away with drugs or just the immune system. Is that what you explained to us?
Yeah. All right. Thank you. You are very correct. According to research, cervical cancer is one of the most treated cancer in the world. So whether it is a precancerous, is at the precancerous stage or even at cancerous stage, if it is detected early through proper screening, it can be treated, and the treatment has been proven to be effective because there are different levels of treatment. So it starts with the screening first. Once you start feeling the symptoms that I mentioned earlier, and then immediately, please do not wait. Let's emphasize this. Let's not wait till things get out of hand. Once you notice anything abnormal in your system, especially at the genital part, go for screening immediately. If that is done, it would make it easy to arrest this condition before it gets out of hand. So once you go for screening and then it is discovered that okay, the cervical cells, the cells of the cervix are, they are growing abnormally, or there's a lesion there, or the cells are becoming abnormal, it can easily be detected, and then that will now suggest the method of treatment. So it could just be normal a drug that will be taken. It could be freezing, that they will just expose the lesions to cold temperature. That's a form of treatment as well. So there are different ways. In fact, it is proven that a cervical cancer patient can still give birth after treatment if it is detected early. So that is why early screening is important. It is treatable. I can say it categorically, and it is available online. Anybody can check that cervical cancer is treatable only if it is detected early. And that is why there are different age groups for different priorities. If vaccination, young girls from the age of 9 to about 15 thereabout are prioritized for vaccines, and then screening is prioritized for people from the age of 24 and above. So that way we can combat it by once you get screened as early as possible, it is detected and it is arrested as early as possible, and in that way you can live your normal life afterwards. So that is why cervical cancer awareness, that's why I appreciate this forum, so that people can know that once you start feeling all of this does not mean that you have it. You need to go for screening first. Let the screening diagnose you. After diagnosis, then proper steps to be taken will be taken, and these steps are already on ground. They're already on ground. It's just for us to go out and assess it. Thank you.
Okay, thank you very much. That was very, very insightful. So, in whole, the addition I'm adding to this is just that cervical screening awareness is just for screening, just to have your results, to have your screening that okay, yes, I did this and this is my result. Because it's not about cervical cancer. Because when a lot of people has cervical cancer awareness, cervical cancer, they feel like no, I won't have cancer. I won't have cancer in Jesus' name. I won't have cancer. It's not about the cancer. It's not about the problem. It's about getting screened so that we can have our results. And when there are 30 women, they will all believe that God made this happen to me. But when you actually take the medical precautions, that is when it is very, very important. And that is why it's important to get screened, which is why this event is actually tagged cervical screening awareness instead of cervical cancer, because a lot of people are very, very scared of that word, and which is meant to be so. So we'll be going to the next question. While I was speaking, I got a question in my DM. But before we go to that and treat that, I also have another question which was asked by a lady, and she said, "Can a lady above 30 still take the vaccine?" And I know we haven't talked about the vaccine yet. So let's like you to explain to us, talk to us about the vaccine, because I believe there is an age range whereby a girl, because that as a girl, should take the vaccine when the lady is still a girl. So what's the age range for taking the vaccine? And this woman actually said that is it possible for a woman above 30 to still take the vaccine? So I think you should enlighten on this question. Thank you.
Thank you once again, Ms. Odedele Florence, for the question. Yes, a lady of 30 or above 30 can take the vaccine, but by above 30, it shouldn't be up to 65. Yeah, because the vaccine is no longer useful for that age group if they have been proven to be negative. So, yes, a lady of 30 can take the vaccine if tested negative, because the purpose of the vaccine is to prevent the infection of the HPV. So if a lady of 30 has been tested to be negative for HPV, definitely she can take the vaccine. And then talking about the vaccine is actually prioritize, like I said earlier, and then I'll keep on saying, is that uh, HPV is a sexually transmitted virus. And so, if a lady that is, or a girl put that way, that is not yet exposed to sex, you know, can access this vaccine, it will prevent her from contracting the virus even at the onset of sexual intercourse or sexual activity. So that is why vaccination is actually prioritized for a younger age, that is age from age 9 thereabout to about 15 or 20, as the case may be. Though that does not mean that people, ladies of older age, cannot take, but it is more effective on younger age that has not yet been exposed to sexual activity. And that is why, and then considering the cost and the availability of the vaccine, so it is much more important to, to concentrate on those age group for vaccination, since screening is available for older age group. However, if the vaccines are available for older age, like from age 9 to like 20, 30, 35, okay, it's fine. Vaccines can be given, they can take it. But screening, that you have taken vaccine even at that age, does not mean that you stop screening. Vaccination does not rule out the position of screening in preventing cervical cancer. Even after taking vaccine at that age of 30, age of 25, thereabout, you still have to go for screening at intervals. Like I mentioned earlier, screening for HPV every 5 years, pap smear every 3 years. You understand? So these are ways to combat cervical cancer. And then that you have taken the vaccine should not make you to expose yourself to risk factors like multiple sexual partners or other factors that can lead to cervical cancer, because the vaccine is not taking away, it's not combating all strains of HPV. The vaccine is not targeted against all strains of HPV. It's only targeted at HPV type 16, type 18, and some few other high risk. So if someone that has taken the vaccine gets exposed to other strains of HPV, like HPV type 11, type 6 and all, and then the virus now stays longer in the system, it can trigger cervical cancer afterwards. So that is the reason why screening is important even after vaccination. Thank you.
All right, thank you. That was very, very insightful, and you touched a lot of places that I was thinking I was going to ask about so that can be discussed, which is that for women who are sexually active, it is very, very, very important, because the age range is not really because these people is young, these people are not young, but it's the specific word is sexually active women, because the virus which causes it, which is human papilloma virus, is a sexually transmitted virus, and this happens when a woman is sexually active, have sex, or have sexual partners, which is more than one. So that's why most times married women are exempted, because they're actually married to their partners. So women who are not married yet, which is why they said the screening should be done within this age and age, the vaccination should be done within this age and age. So it is mostly about being sexually active, which is why most times, even though the range for this vaccination is between the age of 9 to 14, there are still older women who can take this vaccine, which are like the nuns who have not had sex before, so they can still take the vaccine. So the important key and the key word in it is just being sexually active, not really about the age itself. So thank you very much, Mr. Oyedun Akindele, for the insightful explanation. So the next question that I got is, how can a woman lower the chances of getting cervical cancer? I know this has been explained that it is based on age,
but I feel we should still touch the question since it was sent in. So let's just dedicate a segment to answering this question separately, which is how can a woman lower the chances of getting cervical cancer? Thank you.
Thank you once again, Miss Odedele Florence, and every other listener out there. Yeah, so how to lower the chances of coming down with cervical cancer is very easy. And why I say that is because once you know the risk factors, you can avoid them. So, and then I'll go back to them one after the other. Like I said, the first of all is HPV virus, HPV infection, which is usually contracted via sexual activity. So, a way to lower the risk of coming down with cervical cancer is that women should be discouraged from having multiple sexual partners, because this virus is only transmitted via sexual activities. So a way to reduce the contraction or the infection is to reduce multiple sexual partners. And then another way is, if it is possible, to to discourage early exposure to sexual activity. For instance, now, because one of the risk factor is the age, the onset of coitus, the onset of sexual activity. So for people that start sexual activity at early age are prone, to coming down with cervical cancer or contracting HPV for that matter. So discouraging early sexual activity is another way, to reduce the spread of cervical cancer. And another way to reduce cervical cancer is to always improve on our immune system. There are some vitamins that helps in fighting these infections, this HPV especially. Like I mentioned earlier, if one contracts HPV at early age, and you have a strong immune system, the immune system can combat it even without medication. So the place of eating well and eating vitamins is very, very important in combating cervical cancer and in combating HPV. So proper immune system is should be encouraged. Vitamin A, vitamin D, vitamin C, all of these vitamins are very, very important for combating HPV. So that is another one. Another thing, like I mentioned earlier, is it should be discouraged among women to smoke. Women should stop, or if they can't, they should quit smoking completely. Apart from the dangers that smoking has for the lungs, it has been proven scientifically that smoking heavily can as well lead to cervical cancer, because the smoke, the activity, the component of the substance being smoked can lead to distortion of the cervical cells, of the cells of the cervix, which can eventually lead to cervical cancer. So if someone does not smoke, it has limited the chance of coming down with cervical intraepithelial neoplasia, which can therefore not lead to cervical cancer. So smoking should also be discouraged. Another thing is oral contraceptive. Prolonged use of oral contraceptive should be highly discouraged. I mentioned it earlier that prolonged taking of oral contraceptive for a period of 10 years is a great risk to coming down with cervical cancer. So that is why, if you are going to engage in family planning, kindly visit professionals that can advise you accordingly, because they have this information that prolonged usage of oral contraceptive can lead to cervical cancer. So they have this knowledge, and then they'll be able to guide you accordingly to what is best for you. And then another way, to limit cervical cancer is proper screening. You don't have to wait till you see somebody beside you or in your environment having this condition before you go for checkup. In fact, not only for cervix, because as it is known, cervical cancer is the second leading cause of death for women in Nigeria and is the fourth globally. The first cancer is breast cancer and followed by cervical cancer in Nigeria. So which means that even if you're not going for cervical cancer screening, you can go for breast screening and all other screening like that, in order, because prevention is better than cure. And that is why this kind of awareness is important, so that we go for screening not until when you start feeling bad, not until when things are going out of hand. Because if it is detected early, it can be cured, it can be contained. But if it has grown beyond some level, it can disturb other activity. Because for someone that the service has been totally destroyed, there's a tendency for the person to have uterus removed completely. So before I get to that stage, we should always go for screening and know, okay, if the screen proves you to be free, fine. Then you come back again for follow-up. And then if you are positive, immediately treatment starts, and then you have the chance of living a good and longer, healthy life. So, and another thing that I would like to mention is the issue of age too. Like I said, if you have girls between the age of 9 to 40 or 15 that are sexually inactive, please let them go for vaccination as soon as possible. And for as many people that can access the vaccine wherever they are, even beyond that age group, whether you are sexually active or not, get screened. If the screen tells you that you are HPV negative, then get vaccinated as soon as possible. In that way, you can reduce the spread of cervical cancer. You can reduce the spread of HPV. So those are the ways by which we can avoid or reduce the contraction of HPV and then the condition of cervical cancer. Thank you very much. I hope I've been able to answer that question as well.
Yes, thank you very much. You have been able to answer the questions very, very well, and it has been very, very understandable. So I would like to encourage people that have questions to send me a DM, or you should reply on that this tweet with your question, or you should find any means to send me your questions so that I can read it out and can get answers to the questions. And I will have asked other people who just joined us to introduce themselves, but we don't have much time anymore. It's meant to be a 30-minute program, but we have already spent about 40 minutes. So this is the last question I'll be reading out. Then if we have any other questions coming in, you can let me know so that we can wrap up and explain and get answers for the other questions. So the other question is, please, what do we need to do for the screening? I believe this question is about preparation and when we are going, what do we need to go with? I believe that's what the question is about. So please, what do we need to do for going for screening? Thank you.
All right, thank you, Miss Odedele Florence, and every other listener out there. Thank you for the time. So it's so simple. What should be taken along for screening is yourself, with a condition of not doing your menstruation at that point. Because if the screening would involve VIA, pap smear, or HPV, the cervix would still be accessed. So, and then there's no way to access the cervix if you are currently bleeding. So that's one major condition that is important. Apart from that, there's no other condition. Just go get to a standard quality management system laboratory, for the screening. Once you get there, ensure that you are not currently menstruating, and then you commence the screening. It's very, very seamless. It is painless. It is easy. Anybody can do it. You can close your eyes and do it. You can open your eyes and do it. It's nothing to be worried about. The procedure is very, very easy. Just with the aid of speculum, the cervical smear is taken. Usually endocervical or ectocervical, either of those two samples are taken and then sent to the lab easily after proper sample collection procedure. So it's not something that can cause harm. It is harmless, it is painless, it is available. So please, let's encourage people to go for it. It is, and then repeatedly we should do it. That's the thing. That you have done it once does not say that you'll be free entirely, and does not mean that you will have it the next time. It's just to prove that you are still intact, and then you can continue with your life standard that has kept you that long. That's just the reason. So there's no other condition than what I've mentioned earlier. Thank you.
Okay, and that will be all the questions that I got before the event. And thank you for giving enough answers for us to understand. I believe everybody understands this question, because I'm not getting understand this explanation, because I'm not getting much questions. But the other question I got just now is that what is the price range for this test, which is a very, very important question, because it won't be of a good idea just go walking into the clinic without even knowing how much you're paying them. They'll be like, this is the amount, and you feel like, oh, I can't afford it, and you have to turn back home. And when you get back home, you'll be like, I'm not even going anymore. But when you have the preparation in your mind, okay, this is the amount I'll be paying, then it will be easier for you to just walk in, request for your test, pay, and leave. That's all. So what is the price range for this test?
Thank you, Miss Odedele Florence, and every other listener. So, yeah, health is wealth. Price is very important as well, but I'm of the opinion that no matter what the cost may be, it should not be enough reason to deny ourselves proper health care. Self-care is very, very important no matter the cost. But to answer the question, prices may vary depending on the laboratory. For instance, where I work currently, Access to Basic Medical Care Foundation, before now, our HPV screening is as low as 15,000. We have other centers like Naima doing it for 25,000. And there are other centers that do it for 2045. That's the range for HPV screening. It's between 15, currently now it's between 15,000 to 50,000. Currently in the Southwest that I'm aware of. And then, but for pap smear is way cheaper, and that is why people tend to go for that more. Pap smear is between the range of 4,000 to 10,000 naira per patient you get in the Southwest that I'm aware of currently. And then VIA is lesser, I think, for 1,200. And then I would suggest that maybe before the end of this month, or probably by February, if you can have me on this platform again, because my foundation where I work currently, we are actually working on reaching out to about 10,000 women for cervical cancer screening at a subsidized rate, at a highly subsidized rate. I don't want to give figures now, but it will be highly subsidized and very, very affordable. We've commenced. We've been to different radio stations to talk about it, and then we are still going to do more. However, prior to commencement, I would be glad if you can invite me on this platform again to tell people that we've actually commenced, and then they can come with a particular price that is as cheap. In fact, it might eventually come free. I'm not giving my words on that yet. If it does come free, I will let you know. If it doesn't, but I'm sure it will be at a highly discounted rate, so that everybody can access this health care from whatever age range. So, but currently the prices are like that everywhere. I think I've been able to answer that too. Thank you.
Yeah, thank you very much. So I believe we have gotten enough information about this, and the audio will be on my page if anybody wants to listen. Because some people joined at the middle, so you can listen from the beginning and get more information that you might have missed. So while we are speaking, I got this request by Miss Daminola. So I believe she wants to ask a question or ask something, or maybe introduce herself, like we tried to do in the beginning, but we had network issues. So, Miss Daminola, can we have you?
Hi everyone. Good evening. I want to appreciate the host and the speaker of this particular program. It's very, very interesting, and I've gained so much, so much. I just want to greet everybody and say thank you for this opportunity, for this awareness. May God continue to bless everyone in Jesus' name. All right, thank you. Bye.
Amen. Amen. Thank you. So, is there anybody, any other person who would like to say a thing or two or introduce themselves before we end the program? Let me know. Okay, since there's no one requesting for a mic again, I will say thank you very much, Mr. Oyedo Akindele, a great scientist, a man with a lot of knowledge. Thank you for honoring my invitation and speaking with people and sharing your knowledge with them so that they can understand more about cervical cancer screening and everything. Thank you very much. So on this note, we'll be ending the live for tonight. And thank you very much for joining. My name is Florence Otedele. Do well to follow me. I will follow you back so that you can get more tips from me. Thank you very much. Good night.
Good night. Thank you.